In previous videos, we talked about what is GERD and symptoms of GERD. In this video, I want to discuss ways to manage GERD. Now, this video will primarily focus on lifestyle modifications for GERD, and we will talk about medical and surgical options for GERD management in future videos. We will focus more on exploring different options for treatment rather than recommending certain treatment pathways. In individuals in which symptoms of GERD are relatively minor, meaning whose symptoms occur less than once a week, starting with lifestyle modifications is an appropriate approach. There are numerous possible lifestyle modifications, some with better evidence than others. Let's start with the ones that have been shown to have the most proven improvement on GERD symptoms: weight loss and elevating the head of the bed. Losing weight for those who are overweight has been shown to improve symptoms of GERD and also has the additional benefit of improving an individual's overall health as well. Why exactly weight loss leads to improvement in GERD is not completely understood, but one thought is that less abdominal fat can decrease the amount of pressure on the stomach, leading to less reflux from the stomach. If you have worsened symptoms of GERD at night, elevating the head of the bed during sleep is also something that has been shown to improve symptoms of GERD. While you are sitting up, stomach acid has to reflux up against gravity in order to reach the esophagus, which is harder. However, when an individual is lying down in bed, the esophagus and stomach are at the same height level, meaning that it is much easier for stomach acid to reflux from the stomach to the esophagus, as gravity is no longer involved. By elevating the head of the bed, gravity is now involved again, making it less likely for stomach acid to reflux into the esophagus than if someone was lying down. The best way to elevate the head of the bed is to increase it by 4 to 6 inches by sliding blocks or books under the head of the bed. Alternatively, you could also place a wedge under the mattress, although this seems to be less beneficial in practice. Similarly, if your symptoms of GERD usually trigger after eating, try avoiding lying down after meals. Lastly, if you usually wear tight-fitting clothes, changing to clothes that are less tight around your abdomen can sometimes improve GERD symptoms. For some individuals, but not all, certain food groups trigger symptoms of GERD. For example, coffee, tea, carbonated drinks, fatty foods, spicy foods, mint, chocolate, onions, and tomatoes have been associated with GERD in some individuals. It's worth trying to eliminate some or not all of these food groups to see if it leads to any improvement in your symptoms, but this might not be effective for everyone. Lastly, there's also some evidence that quitting smoking and drinking can decrease symptoms of GERD. Doing so also has the additional benefit of significantly improving your overall health, just like with weight loss. In this video, we have explored lifestyle modifications that can be used to improve symptoms of GERD. These modifications include weight loss, increasing the head of the bed, not lying down after meals, avoiding food triggers, and smoking and alcohol cessation. We will discuss medical and surgical options for GERD management in a future video.